Hello everyone, we are on take 2 of the video. I was having some technical difficulties. I'm gonna make sure that everyone can still see me. My name is Vanessa Anderson Smith and I am a Talk Tools instructor. Today I'm gonna be answering some questions about the biggest feeding difficulties of 2020. There's been a lot of difficulties with 2020, obviously. So anything that I can do to help answer some feeding questions. We're going to talk about the Feeding First, Connect and Collaborate online conference that Talk Tools is hosting in October. It's October 13th through the 23rd. What we're going to do today is I'm going to go through some questions. I will talk a little bit about the fellow instructors that are going to be presenting at the Feeding First conference. And then I'm going to be announcing a winner of someone that is going to be getting a free seat to the conference. I am coming to you from South Dakota. For those of you that don't know me, my name's Vanessa Anderson Smith and I'm a Talk Tools instructor. I also own a private practice in South Dakota. And we are going to be talking a little bit about how we can help you with teletherapy. Has been a big deal with trying to do feeding therapy over teletherapy and how we can really get engagement. We're going to be talking about some COVID issues that have come up this year as well. So let's get it started. The Feeding First Connect and Collaborate concert is going to be October 13th through the 23rd. We have over 40 speakers that are going to be presenting on various topics. We have a lot of people who are very well known in the industry that we're lucky to have. Marsha Dunn Klein, Melanie Potok, Deborah Beckman, our very own Lori Overland is going to be doing the, the keynote for the conference to kick it off, and a lot of fellow Talk Tools instructors as well. One of the big questions, what we did is we had people submit questions saying, what are your feeding challenges? How can we help you? And we had over 1,000 questions submitted. Obviously, I can't get to all of those today. I'm going to hit on some of the big ones. And stay tuned because maybe next week or the week after we'll be going on a Facebook Live again to get into more questions. By far, the biggest question that we had was teletherapy and how can we do feeding therapy via teletherapy? And I'm here to tell you that, of course, it has its own challenges. What we did at my clinic was in March, we shut down for about a month. We went to all teletherapy due to the COVID pandemic. And we had to, it was what I like to say was it was the same but different. We're doing therapy, but we had a different medium to do it through. And it definitely had its own challenges. But face-to-face therapy has its own challenges too, that we are very much aware of. What we did was we had a therapy platform and we were doing we're trying to make it as interactive as we could. And I'll be the first to admit that the patients in the age range of 2, 3, 4, 5, they were tough to do teletherapy with. Then I had some of my teenage patients. They did great with it. So it was a lot of trial and error. What can we find to really engage our patients? I think we found ourselves to be, we're coaches and cheerleaders to parents and to children as well. So a couple things that I can go over that we did for teletherapy was, especially in regards to feeding, because people say, well, how can you do feeding therapy when it's not hands-on? Well, you can, but you definitely have to have the right support system. However, that's no different than in-person therapy. We always have to have the right support system. We have to have a good facilitator there. It's not always the parents. I'm a parent. I know how it goes. Kiddos don't listen to their parents as much as they listen to teachers, therapists, other people, even siblings. They'll listen to siblings better. So it was, who can we get that's going to really engage the child? And it's not always the parent, and that's okay. We've had, patients that have nursing care around. They'll help us facilitate. And like I said, siblings, teenage siblings as well. It's whoever clicks with the parent, with the patient. I like to make it as interactive as I can. I would always have stuffed animals available. I have Elmo here. I would have all of my tools available. Sorry, I'm trying to hold my phone and everything. Chewy tube, I usually would have my Chewy tubes, but I'm at home right now and this is just what I pulled from my son's drawer. But when it would be time for the child to do Chewy tubes, guess what we would be doing? Elmo would do Chewy tubes too, all right? Elmo would take bites of food. And then sometimes Elmo would leave, he wouldn't always be there, he'd pop back, just to kind of keep kids on their toes. And however we can make it fun for them. I would have kids, especially for feeding therapy, work for, I think a lot of people have seen the YouTube video called Surprise Eggs, which is children opening up little plastic Easter eggs and there's different things in them. I found a bunch of miniature food items that you could put in there. Anything from sandwiches to macaroons to donuts. I think there was sushi even. So for feeding therapy, I thought it was really fun. I would have the eggs out and I would have the kiddos, I'd say, do you want to open the green one or do you want to open the pink one? They would pick and we would open it up and there'd be a different kind of food in there. We could talk about the food and just start exposing them to different foods as well. And it was just a quick little motivator and it was fun. The kids really liked it. I was surprised because I thought if they couldn't have the object in there, how engaged would they be? But they loved it. So that is a couple things that I did with teletherapy. But I think we all know that there are limitations to teletherapy, the way there's limitations to in-person therapy, the way there's limitations to group therapy. And we always have to be mindful of that, especially during the COVID-19 pandemic. And my office was closed down for about a month between the end of March and June is when we went back. Now, everyone is going to be different. Everyone's coming from a different situation. So here in South Dakota, our numbers were pretty low and it's always a calculated risk going back, but that's going to be dependent on each person. And it's a moving target always that we know. What we decided to do was to open back up slowly and stagger it. We still had some people that were not quite comfortable coming back into therapy in person, and that was fine too. We still continue to offer teletherapy, but there were times where it was just evident that we weren't going to be able to make as quick a progress via teletherapy as we could with in-person therapy. For instance, I work with a little girl that's on honey thickened liquids. I was not comfortable having her trial nectar thick liquids without me being there to really fully assess what's going on. Or when you have children that need to move from purees to more advanced textures. Those are things that, to me, it was worth the risk to go in and to mask and use proper precautions because it was too risky to actually do that via teletherapy. And that's going to be different for everybody. So when we opened back up, what we did at my clinic was there was a waiver that went out and informed consent saying, we're doing everything that we can. We're meeting and exceeding CDC guidelines, but there is always a risk for what we do. And that there's a potential that COVID-19 could be going around, whether it's our clinic, the grocery store, wherever your child's going to be. So we had waivers signed, and every day before a parent brings their child to therapy, there's a waiver that we go through. Have there been any exposures, any fever, cough going on, and we are taking temperatures as well. In addition, we have closed down our waiting room. Our waiting room has been closed down since, I think, the end of February. And what we're doing now is we separated entrances from the dental clinic that I share a building with. So we have a separate entrance, and parents will text us we bought a system, and they text us when they're there, and then we text them back from our computer saying that we're ready, and we'll meet them at the separate entrance. And we go through the waiver, and we take temperatures, and we do hand washing at the beginning and end of every session for the patient and for the therapist. And we've had some really good luck with that. We haven't had, knock on wood, any exposures that we know of. Everyone's been staying very healthy, and it was all up to the individual therapist when they wanted to come back, up to the parents when they wanted to bring their children back. But so far, so good. We're lucky. It's always going to be a moving target, and I think that we all know that in a couple weeks, this could all be different. But as of right now, that's what we're doing. Obviously, patients have to bring in their own tools. The only time that we're using our own tools is during evaluations. I have found some really good masks that I will show you. These are from Rafi Nova. And you can get the kind that has the tie around or the ear loop. But I'll do therapy like this. And it's definitely doable. I haven't had any kids be scared of a mask. We're really lucky with that. Kids are they're dynamic and they adjust a lot better than I think we adults do sometimes. So what I do with these is I put a clear or a thin film of soapy water to help it from fogging up, and that seems to help a lot. We do a lot of oral facial myofunctional therapy, and we'll also sometimes use, we have head or face shields that we can use as well. So that's kind of how we've been adjusting to it. You know, I think in this day and age, a lot of people can worry about what's COVID-19 going to do to my business and my practice. And I'm here to tell you guys about what it did for mine. And did it have its challenges? Absolutely. But we also we kept changing plans, as everyone has been. And we actually ended up opening up a second location. And since the COVID-19 pandemic, my clinic has seen more sessions than we ever have. And I think that's due to us being flexible, families being flexible. We now have teletherapy options that we didn't have before just due to insurance reimbursement. So it's definitely possible to do feeding therapy during a pandemic. And it's going to be different for everybody. And everybody has their own calculated risk. So that's just what we're doing here. And like I said, it's probably going to change in a couple weeks. So let's get into some feeding questions. Like I said, we had over 1,000 people send in questions. Let's see here. I'm going to read through some. Let's see here. We have some really good questions about what's the role of dietitians in feeding therapy with SLPs. That's going to be we have a section on that at the Feeding First conference. Brittany Coleman is a registered dietitian, and she is going to be having a session that will be really informative. And finding a good dietitian is essential to really completing that multidisciplinary team for a child and making sure that they're getting the nutrients that they need and all the caloric intake that they need. Let's see here. There is Melanie Potok. Like I said, she's going to be presenting as well. Deanna had a question about motivation. She has a son that's 5 and has been on tube feeding since the day he was born. It's a fight to get him to touch food, let alone bring it to his mouth. They're looking at intensive feeding programs. Let's see here. Oh, I'm sorry. I realized that it's not Brittany Coleman. It's Britton Coleman. Sorry, Britton. Can't wait to see your presentation. She is the registered dietitian that's going to be having a presentation at the conference. Anyways, getting back to a question that would probably be really good for Melanie Potok from Deanna about her son who is 5. They're looking at intensive feeding programs, and he's received feeding therapy since he was 5 months old, but he doesn't really show interest and refuses and fights any attempts at food, even though he has the skills for safe eating. Melanie Potok has great information about, sounds like there's a lot of anxiety going on there with your son, Deanna, and Melanie Potok has great information on that, about the role of anxiety and what that plays in feeding therapy, which once we give them the skills, the oral motor skills, I always tell parents that's the easiest part, is working on the oral motor skills. To me, the hardest part is that mental part, those mental blocks of, I don't like this food, or this food scares me. So I've learned a lot from Melanie Potok about that, and she will be presenting. Like I said, we also have Lori Overland, who's going to be presenting the keynote. She's a leader in our field, and she'll be giving some good information about sensory motor difficulties and working with medically complex children. I'm going to see if there is any Any other questions? Let's see, I think Mary's on. Mary, if there's any questions, let me know that I can get to. I'm gonna pick out one more question. Let's see. Someone wrote, as the field of pediatric orofacial myology becomes more known, I'm struggling to put together a team of professionals who can support therapy, ENTs, pediatricians, etc., who will make therapy more efficient and more effective. That's a huge thing. It's hard to find your tribe, but once you do find your tribe, it's a deal breaker. Kids are gonna get better, faster, it's gonna be a lot more efficient with therapy. I think that for years, I felt like in my area, I was the only person who even thought about tongue ties and who even thought about orofacial myology. And I felt like I was banging my head against the wall for a while. And I didn't realize how many people were actually listening. And slowly but surely, I found my own tribe within my community. And a lot of times it's parents that are connecting all of us. I'll have a parent say, well, this dentist actually does that, and I had no idea. And then I would reach out to that dentist, and reaching out to chiropractors in my area. They have been great as well. So I think that networking is everything, and you're gonna get shot down a lot before you actually find the people that you're meant to work with. So don't be discouraged by that. All right, well, before we wrap up, I wanna talk a little bit about, stay tuned, because we are gonna be doing another Facebook Live going over some of the questions that you guys have. And I'm excited to announce a winner of someone that gets a free seat to our Feeding First conference. Drum roll, please. Let's see. Caitlin Cooper. So she is a speech language pathologist and, most importantly, a mother to a sweet baby girl with Down syndrome. So congrats, Caitlin, on, first of all, your new addition to your family, and secondly, getting a free seat at our conference. So we can't wait for you to learn more, and it's gonna be a lot of great information. Everyone stay tuned. We're gonna go live again, hopefully in the next couple weeks, and keep sending us your questions. I'll be checking back on the Facebook page, and I can answer any questions that are still out there. Bye, everyone.